Hi, my name is Sydney Van Arsdal, and today I'm going to be presenting my senior portfolio. I'm going to be sharing some of the experiences that I had during my time at Nebraska Methodist College in the traditional BSN program, and how these experiences have helped me to become an educated citizen by growing as an effective communicator, a reflective individual, and an agent for change. I'll also be relating these experiences back to my public issue of human trafficking in Nebraska. I don't have a personal connection to this issue. I was just interested in the complexity of it. I wanted to learn more about the vulnerable populations and also society and how it plays a role in human trafficking. The first thing I'm going to share is an experience that helped me to become an effective communicator. So this happened to me in Nursing 210, and at the beginning of the semester, we were given an assignment to do a teaching plan with one of our patients. And I wasn't quite sure what I wanted to do my teaching plan on, but I was kind of waiting for that teaching moment. Well, the last day of clinical came around and I still had not done my teaching plan. So I threw something together really quick, and then when I got to clinical that day, I had my teaching moment. And so I had to scrap everything I had, but this experience ended up being a better communication opportunity for me. So what I had to do was I had to teach a patient how to give an injection at home. And not only did I have to use demonstration, but I had to use written and oral forms of communication. And I really felt like I connected with my patient on that day. So what I learned through this experience is that I have the ability to educate my patients through effective communication. And how we can relate that back to human trafficking is you have to have those communication skills to be able to educate people who may be at risk for human trafficking, to help them identify the risk factors. The second experience that I had that helped me become an effective communicator was my experience as a supplemental instruction leader. So I was the supplemental instruction leader for Anatomy Physiology 1 for 2 years while I was at Methodist, and I had to use many different forms of communication during this time. One of my favorite topics that we would go over in supplemental instruction was nerve signaling, and I really enjoyed this topic because at first students had a really hard time understanding it because it is quite complex, but it lays down the foundation for your future classes like pharmacology and pathophysiology. So I wanted students to have a really good understanding of this concept, not just for anatomy and physiology, but also for their future success. So I had to use many different forms of communication to engage the entire class and also to keep students interested. And through this, I learned that to be a strong communicator, you have to tailor your communication methods to the individuals receiving the communication. So everyone learns a little bit differently. And so as a communicator, we need to tailor our communication method so that the person receiving it can get the most out of it. I can adjust my communication depending on the individual to support and advocate for victims of human trafficking. So many of these victims may be very different from myself, or they got into this situation for many different reasons. And in order to communicate with them effectively, I need to understand where they're coming from and also understand how they perceive communication the best. So next, I'm going to talk about how I have become a reflective individual. So I've reflected on many of the experiences that I've had during my time at Methodist. One that really stood out to me was in Nursing 340. We got to participate in the mini LUSA Elementary School Health Fair. So my classmates and I, what we ended up doing for the project was we went out into the community and found different resources and then got different donations from those resources that we could bring back to the school, and then we gave those resources to the school nurse so that she could identify the students who were in most need of them. Through this experience, I reflected on how important community nursing is and all the different ways that you can incorporate community nursing into nursing in the hospital. I also learned about different ways that I can better identify people who need these resources and different ways to find resources within the community. I can help human trafficking victims by identifying their needs and then also connecting them with vital resources. The second way that I've become a reflective individual, or another way that I've learned about becoming a reflective individual, was when I got to participate in a poverty simulation here at the college. The purpose of the simulation was kind of to experience what it would be like to live 1 month in poverty. And although the simulation was only an hour long, it made an impact on me. One of the things that was really brought to my attention is that a lot of people living in poverty might have to choose between getting a job and losing all governmental assistance or getting a job and keeping governmental assistance. So that can put them in a really difficult place. And that was just one of the things that I learned about poverty through this simulation. It changed the way I view poverty and also that community, and it just gave me more empathy and understanding for people in that situation. Poverty is a big contributing factor to human trafficking, and I can use this understanding that I gained through this experience to better connect with victims by showing empathy and then eventually building trust with them. Next, I'm going to talk about how I've become a change agent. Through Methodist, I've learned the importance that nurses have in the community as agents for change. My first experience that I would like to share was when I participated in a community-based experience at Benson Baptist Church. The purpose of this experience was to be checking blood sugars and blood pressures for people who most likely wouldn't be able to see a primary care provider due to financial or lack of insurance, things like that. So one patient that I interacted with that day, he didn't know that he had high blood pressure, and he also didn't know that his blood sugars were high. So I was able to educate him about what are some risk factors for diabetes and hypertension. I was also able to give him the resource of the Charles Drew Health Center. And through these conversations, I could tell that he felt really empowered and felt very knowledgeable, so that next time he saw his doctor, he was able to bring up these issues and not feel like he didn't know what he was talking about. So through this experience, I learned that I have the ability to empower others to help them advocate for themselves. So we're not always going to be there sitting next to our patients. So through education, we can give them that empowerment so that they feel comfortable talking about their own health needs. Many human trafficking victims have trouble advocating for themselves. So as nurses, we're in a position to help empower them and then also give a voice for them when they can't advocate for themselves by doing things like educating the community. The last experience I want to talk about is another way that I've become a change agent. So at Methodist, I was enrolled in the Complementary and Alternative Medicine course. Complementary and Alternative Medicine is also called CAM sometimes for short. In this course, I learned about many different ways that we can care for our patients. So not only just the traditional ways of caring that we learn about, but also thinking outside of the box. And I actually got to experience healing touch firsthand while I was in this class. And I found the experience really relaxing, so I could see how it could be beneficial to patients. Some of the focuses of complementary and alternative medicine are things like holistic care and treating ailments such as pain and anxiety. And some of the things that I learned is that as nurses, we need to focus more on that holistic care, not only treating the patient's physical ailments, but also their mental and spiritual health. And there's a variety of interventions that nurses can perform that could be considered complementary or alternative medicine. So with the complexity of human trafficking, it makes it critical that we look at these victims in a holistic way and treat them as individuals. Also, many of them may experience things like PTSD and anxiety, which is a lot of what complementary and alternative medicine focuses on. So I feel like through the course, I got a really good understanding of things that I can use with my patients in the hospital, but also helping people in the community. So in conclusion, I feel that I have grown as an effective communicator, a reflective individual, and an agent for change through my experience at Nebraska Methodist College. I've reflected on all of these experiences that I've had through nursing school, and I feel that I can really carry this knowledge into my career and use it to guide my future learning as a nurse. As a nurse, it's so important that we always keep asking questions and we commit ourselves to being lifelong learners. And I feel like through the experiences I've had at Methodist, I really value that. Also, this learning will not only help me care for future patients, but help me support victims of human trafficking. So I look forward to graduating from Nebraska Methodist College and starting my career as a nurse.